This is Full Steam Health's Virtual Rounding Visualizer, built to support multidisciplinary rounding on chronic disease patients to address gaps in care. These teams would be assigned by the health system, typically including a primary care physician, a specialist, depending on the disease state, a pharmacist, and a nurse care manager. Other roles can be added to the multidisciplinary rounding team, such as social workers. When you open the module, you will see chronic disease areas the health system is looking to address. When you click on a disease area, you will be taken to a module to aid the multidisciplinary team in making the most appropriate care pathway decisions. Here, you are seeing patients listed based on their risk of progressing to end-stage renal disease. This is leveraging a statistical model that takes age, race, sex, and other phenotypes to predict a patient's likelihood of progressing to ESRD in the next 5 years. These modules create lists based on statistical models or a set of heuristics the health system chooses. When you select a patient, you can view additional information about that patient, ranging from demographics, labs, vitals, and medications, which have all been curated. These views can be customized based on data that would best support a rounding team. In this case, the rounding team can quickly see the change in a patient's eGFR over the last 12 months. When you click on this information, the rounding team can view a graphical representation, the trend in eGFR, for a patient over the last 12 months. Once the team has identified what the current state is of the patient, which can include additional chart reviews, they can assign a care plan. Here, you see there are 4 care pathways identified. These can be customized by the health system and by the disease module. The team is recommending medication management and is providing notes based on the recommendation. And as you can see, they are making a recommendation to the primary care provider. Once the care manager sends a message to the patient's provider, they would make note of that in the module. They would then assign the recommended care pathway recommendation. To keep track of patients, the team can then view patients they have rounded, on which includes their care pathway recommendation, and show that there has been a message sent to the patient's primary provider regarding the recommendation. Virtual Rounding Visualizer is a novel approach to addressing gaps in care to aid in assigning patients to the most appropriate care pathway decision, which enhances a health system or accountable care organization in care coordination and cost reduction.